I am Karen Friedman. I'm the Residency Program Director and I'm the Vice Chair of Education for the Department of Medicine in the Northwell Health System.
Northwell is one of the largest healthcare systems in the nation, and the Department of Medicine is the largest department in the health system.
We are a joint program between Northwell and our Zucker School of Medicine, and our residents rotate between two of our main tertiary hospitals.
The program is really based around Long Island Jewish and North Shore University Hospital, where you will see pretty much anything that you will come into contact with in the world of medicine.
They are two hospitals that geographically only sit about a mile apart, but they're very different hospitals.
And not only does that expose you to a wide variety of social, academic backgrounds, but also a wide spectrum of disease.
Speaking about Queens specifically, it's one of the most diverse places in the nation, if not the world. The benefit of that is that now if I go into the field and work, I'm able to connect with those people. And so that's something that's very valuable, that's not really appreciated sometimes if you don't work in a diverse setting.
In terms of our experience as residents and working in the hospital, it means that we get to see a very large variety of patients.
As an academic environment, I think that our department is really tremendous.
We really try to take a lot of the innovations from our medical school and move them over to the curriculum in the residency program. We want our residents to be self-directed in what they learn.
You have your choice of electives in terms of what electives you want to participate in. In the second year, we offer a variety of tracks. The program is very flexible. It's a priority for us, for the residents, to be able to individualize their experience.
It has a lot of great teachers, both to teach you and to teach you how to be a teacher yourself, if that is something that you're interested in pursuing as a career.
Because we want to train the future generation of medicine leaders, we pursue what we call the tripartite mission of education, research, and clinical care. Our program is really rigorous, but extremely supportive.
I feel very strongly about each one of my residents having mentors, and they have more than one kind of mentor in our program.
We reach out to everybody early on, even before they start, to gauge what their interests are, and we will assign them a mentor in that particular field.
We have an official faculty mentor that we follow throughout our time here. But also, I think that mentorship happens very organically and frequently. The nice thing about being at such a large health system is that there are an enormous number of research opportunities available.
So research is really a critical part of the training.
We have opportunities in all different forms of research that includes big data and the use of tools to focus on outcomes research.
It's very important to stay current with medicine because the scientific knowledge is exploding. One of the tools that we use is what's called point-of-care ultrasonography.
Some of our attending physicians here are real international leaders in point-of-care ultrasound.
That's something that I think is unique to this program because from day one, interns are oriented to ultrasound, and we can use that every day.
With the onset of the pandemic and other sort of social stresses, we want to make sure, though, that our trainees are really sort of taken care of.
Having administration here that actually cares about your wellness as well as your training is something that I noticed.
We schedule every resident wellness days throughout the year to kind of take care of those things that you don't even think about when you're working full-time, and that's above and beyond the 4 weeks of vacation that everyone's scheduled throughout the year.
We also have activities nearly every month to kind of just help us, connect with our fellow residents, but also have some fun.
There is such a sense of community here. We're all just really good friends, and it's the people here I think that they select that they kind of know will fit.
We have a very large residency program. We get a couple thousand applications a year. We probably interview between 500 and 600 individuals to fill about 60 spots every year.
Yes, it's big, but you'll never be a fish out in the ocean. You'll always feel like someone cares about you here.
We look for candidates, first of all, from all over the country who are not only talented, but also are really excited about being change agents.
Above all things, I want people that are passionate, enthusiastic, and intellectually curious.
This program has prepared me to be a strong thinker.
In terms of the type of doctor this program has prepared me to be, it's one that's compassionate. And then from a technical standpoint, I feel comfortable handling the sickest of patients.
The experience that you will get here at Northwell, you will see everything and you will be able to take care of any patient who comes your way.